So we talked about the dietary modification for accidental bowel leakage, which is important, improving the stool consistency, making sure that the stools are well formed and not loose. Once we get to that, of course, it's important that any patient who has any red alert signs, such as blood in the stools or significant cramping, significant weight loss, any of that should get a colonoscopy done. Rule out anything in the bowel that's causing the bowel leakage. That's very important. Once a patient has had routine colonoscopies, remember, most of cases of constipation and bowel leakage are of no cause, no known cause. So now that you've done dietary modifications and improved the stool consistency, despite that, if you're still losing stools, then the next thing that we recommend is doing pelvic floor muscle strengthening. So similarly, as you can see in the pelvis, this is the bottom part of the pelvis, this is the inside of the pelvis, and this is the uterus, which is trying to deliver itself out. Let's put it back where it belongs. There it is. So this is the uterus, the bladder, and the rectum at the back. And when you look from the bottom, you can see this is the rectum opening, the anal opening, and the muscle around it. So it's strengthening this muscle, which is so important. And it's hard to just do it on your own. It's important to do it with a trained pelvic floor physical therapist, and we have someone in our office who comes in and she does pelvic floor physical therapy for our patients, and with that she helps improve the rectal sphincter. So dietary modifications, sphincter management is so important, and once you improve the strength of the rectal sphincter, it'll help get you from point 1 to point B. So for example, I feel the bowel hurry, I need to go, I tighten my sphincter, I walk to the bathroom, and I can make it. So that is important. So the key principles are improving the stool consistency, number 1. Number 2 is pelvic floor therapy. Very important 2 facts to get done before we even get to anything surgical or further.